Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, we're going to talk about the top 5 ways to know if you have a broken ankle.
And this is really important because broken ankles are common.
Yes.
Read my lips. Broken ankles are common.
Yes, we're still in the middle of COVID, hence the masks.
Right.
Okay, so Paul, do you have a handy model just to show us what we're talking about when we talk about a broken ankle?
Here is a foot and an ankle.
Okay.
So the ankle joint is made up of the bottom of the tibia.
It's on the inside.
Right. The bottom of the fibula.
On the outside.
And the talus, which is the bone in the foot.
The underside.
The underside. Okay, so tibia, fibula, talus. Don't say tibula and fibia like a lot of people do.
Yes.
It's tibia, fibula, talus.
And the broken ankle, if you break your talus, that's really not typically considered a broken ankle. We're talking about the other two.
Yeah, we're not talking about breaking your talus. We're talking about breaking, most commonly, the fibula.
Yeah.
And sometimes and often the tibia.
Okay. And they're also called malleoli. So the medial on the inside and the lateral on the outside, malleoli. That's another term you might hear your doctor use.
Yeah, so the medial malleolus is this part on the inside of the tibia. The lateral malleolus is this part on the outside of the fibula. And sometimes we refer to the posterior malleolus at the back of the tibia.
Those little bumps that you can feel on your ankle. Okay, so Paul, top 5 reasons. What is the number one reason that you can know that you have a broken ankle or think that you have a broken ankle?
It hurts.
Okay.
Pain, all right? Pain is one of the most important symptoms of a fractured bone anywhere, and in the ankle, a fractured ankle will hurt.
Okay, I think that's a good one. Number 2 for me is a history of trauma, a history where you've actually hurt your ankle. So if you hurt your ankle, there's obviously a possibility that you broke it or sprained it.
Sure. So trauma is often sort of like an inversion injury where you're walking and you twist this way and you break the lateral malleolus or maybe even the medial malleolus if you have like an inversion and a twisting mechanism. So yeah, some trauma. Do you need trauma to have a broken ankle?
So I'd say in general, I'd say yes, unless you had what's called a pathological fracture related to some bone disease. But in general, I'd say yes.
Yeah. And there are stress fractures that can occur in bones, in the feet or the shin bone. Stress fractures don't need trauma. They occur from overuse. But it's unlikely to get a stress fracture in the ankle.
Agreed.
Okay. So we got pain. We got some history of trauma.
Yep.
My next big one is deformity.
Okay.
So, I mean, like, basically, if your knee is pointing north and your foot is pointing west, well, that's pretty significant deformity. If there's some deformity there, there's a good chance that you broke your ankle.
Yeah, there's some crazy videos available that show severe deformity where stuff is pointing in the wrong direction.
Right.
Yeah.
And if it's really pointing in the wrong direction, you probably have a dislocation as well, but it's very rare to dislocate your ankle without a fracture. So usually you'll have a fracture or a fracture dislocation where the ankles come right out of joint because of the fracture.
Yeah. Okay. So it looks super weird. So that's number 3. So number 4 for me, this is a reasonably reliable one, if you can't walk on it. So your inability to weight bear. There are a set of guidelines actually out of Ottawa called the Ottawa Ankle Rules, and one of them relates to your ability to weight bear on a sore or injured ankle. So if you can't weight bear, that increases our probability of you having a broken ankle.
Yeah, inability to weight bear. So if you Google Ottawa Ankle Rules, those are rules designed for the physician to know when to order an x-ray of an ankle because there's a good chance that it may be broken. So inability to weight bear is a good number 4.
Yep.
And number 5 is tenderness, point tenderness.
Okay, so not just that it hurts or that I have a sore ankle.
Yeah, and I don't mean tenderness in the way Elvis Presley would use the word. I mean tenderness in the fact that it hurts if you push on it. So that's different than pain.
Right.
Pain is you're sitting there. Pain's a symptom. It hurts when I'm sitting there.
Yes.
Tenderness is a sign, which means it's something that's elicited by a test, which is pushing. If you push on the end of the fibula or the end of the tibia, so the medial malleolus or the lateral malleolus, and you have pain there, that's called point tenderness when you have pain when you push on it.
And so not just when you push around the ankle, but when you actually push on the bone, because obviously if you have a severe sprain, you might not be able to weight bear. You're going to be sore. You're going to be sore in some spots that you touch.
You will.
But if you're not sore on the bone, that increases our chances of a broken ankle if it's sore when you push on the bone.
Okay.
5 good reasons.
So let's review.
Okay.
We said, who started? Did I start or did you start?
I think I started.
Okay.
Trauma.
Trauma. Pain.
Inability to weight bear.
Inability to weight bear. Deformity.
And tenderness.
Not the way Elvis meant it.
You're
All right. Then if you got that, get to the doc and
Yes.
get it checked out. And how do we diagnose it?
So we always say history and physical exam, but the confirmation of a diagnosis of a broken ankle typically comes with an x-ray. Every now and then maybe you'd need a CT scan if you couldn't see it on x-ray, but I'd say x-ray the lion's share of the time.
Definitely. So you go in there, your doc does a history, a physical examination, and then an x-ray is ordered, and that usually the vast majority of the time will show if there is a fracture there.
And you don't even have to have all 5 of the things, right? So if you have
No.
1, 2, if you have 5, then yes, for sure.
You
But
could even have 3.
sure, 3 out of 5, it's majority rules.
Yeah, even 1. If you're so basically, if you think you broke your ankle, those are some guidelines to help you get an x-ray and get the diagnosis, and then you can get the treatment.
And if you like this video, please like it, subscribe to our channel, leave us some comments, let us know your experience with a broken ankle.
Yeah, we would love to read some broken ankle experiences. Did you ever break your ankle?
No, severe sprain. I thought I broke it. I was sore, I had trauma, and I couldn't weight bear, but it wasn't broken.
Yeah. Same. I had a bad sprain, and but it wasn't broken either. But they can mimic each other.
Yes.
So remember, you are in charge of your own health.
We'll see you next time.